a minute or two behind.
All right.
Okay, thanks for that, Andrew. So hello everyone, my name is Helen Clegg. I'm a Senior Academic Policy Manager in the Student Conduct team, and because of the topic of this, I thought it'd be useful to get my much more informed on AI colleagues, Scott and Andrew, to come and help out with this, because although I can speak quite confidently about the conduct aspect, their knowledge of AI is far more substantial than mine. So if we can move on to the first slide, please, Andrew. The most common question that we are asked in the conduct team is, what can we look for? What gives us a clue that something might be generated by AI? And I think the short answer is you can't really know easily, but the sort of things that we see, fabricated references are things that don't relate to the topic. So one that we had last week was a geography assignment, and the references that were within the text related to things like breast cancer, microbiology, and so on. So not only had the student had that generated, but they also hadn't read it because they would have seen these appearing clearly within the text. We sometimes also see these sort of generic descriptive sort of paragraphs. So it might look like, here's a paragraph about this topic, now here's a paragraph about this topic, and they don't really adhere together, they're not really linked, they're very descriptive. They might over or under answer the question. Sometimes we see huge amounts of unnecessary detail, including things that aren't being asked for, or an obvious one that might mean that someone else has written this, is that the writing style is very, very different from what you've seen the students submit before. That can also be the case with SEMILs. It doesn't necessarily mean AI. Or sometimes they just don't support the arguments that they're making, or, as I said before, they have these descriptive paragraphs that don't link together or actually lead to any sort of argument. So all of these things, even all of them together, don't necessarily mean that the student has used AI, but it does mean you should have a closer look at it. And there are things that you can do. You might want, for example, to have a viva with the student, especially if it's dissertation stage. That can be a good thing to do to find out if the student actually understands what they've written about. We don't recommend using AI checking software. A, it's not particularly accurate, and B, they can be data scraping to improve the AI. We also don't permit it to be submitted by the student as evidence that their work is not AI generated. So we really don't want that from either side. Could we move on, please, Andrew? So as I said here, the student can conduct a viva with the student if they want to do that, if there's a suspicion but they're not really sure. That can also check for things like essay writing. It doesn't necessarily mean AI. If it's an undergraduate level 1 or 2 student, then in line with the norm, the school can deal with that case themselves under the school head's procedure. Otherwise, refer it on to the student conduct team together with a note of the viva, so that we can see what the student was asked, how well they understood it, and where the deficits were. We then we'll ask the student to come to an interview. We'll give them the allegations, so they'll know exactly what's been accused, and they can attend, or they can submit a written statement. They can do both, and they won't be questioned on the specific topic because the Senate assessors interviewing them are not experts in that area, but they will be asked about their process and explaining things like, why did you change your topic at the last minute? Why does this piece of text not make any sense when combined with the rest? The overall context will be looked at. So depending on how bad it is or how the student responds, the case might be escalated up to a full conduct committee, which has got greater penalising powers. In either case, the decision is made on the balance of probabilities. So we're not looking for absolute proof, and we would never probably get absolute proof that the student has not written this work. But if the Senate assessors or the committee think it's more likely than not that you haven't written this, that it's been AI generated, then they will apply a penalty for that. And if we move on to the next slide, we can see what is typical once these cases come to us. So assuming that the case is established and the assessors have decided that the student has done something, then the normal penalty would be a grade H without a resubmission opportunity or a reset. There might be a grade H for the entire course if it's particularly bad, or in a couple of cases, or I think one case this year, we've had the credit was refused for the overall course. That was a student that had submitted every answer to every exam in the whole diet was AI generated. And we know for certain that it was because the student admitted it. So that was refusal of credit for the courses to which that existed, to which that contributed, which meant the student had to repeat the entire year because they didn't have enough credits to progress. Also, suspension and expulsion are options if the case is escalated up. That case was probably on the cusp of one that we would escalate up. So they could potentially be expelled, particularly if they do it repeatedly. And then the final slide that I have before I hand over, we didn't have any cases at all of AI referred to us until this academic year, 22-23 just gone. We had 36 cases, which was quite a lot, mostly towards the second half of the year. 15 of them got a penalty, and one was found not to have breached the code, or there was insufficient evidence that they had breached the code of conduct. A few were sent back to the school because the evidence just wasn't really there. There was some suspicion, but it just wasn't strong enough. And 15 are still pending either with the Senate assessors or with the schools who are dealing with them. And I would expect some of them will receive penalties as well. We know that it's a tip of an iceberg. We know that there will be many more cases that we don't know about, but this is the state of how things are at the moment. So that's the conduct aspect of it. So I think now, is it Andrew or Scott who's going to take up next?
It's me. Hi. So thanks, Helen. So I'm Andrew Stroon. Scott and I are from SLD Student Learning Development. And so we've been putting together the student guidance on this, working off of what the official university position has been. So our approach has been to recognise that the university is saying that, in essence, there are a couple of different approaches that we can take here. Either don't use AI, use it in a very particular way with a particular purpose or a particular reason, but that our default assumption is that students are likely to use AI in their assessments, whether we want them to or not. It's likely that they are still going to be using it. And so the guidance that we've put together then kind of echoes that, with a focus on students showing and showcasing where and how and why they've used AI. So in the classes that SLD have run already around about this, so we did this with our incoming undergraduates, for example. We walked our students through some examples of where AI might be used to try and showcase a lot of the downsides to this, a lot of the challenges, a lot of the problems that AI currently has. So our approach has been to try and educate students as to what AI is, and what it can do, but also what it can't do, with an acknowledgement that students are likely to use it. So our approach for this has kind of three parts to it. The first one is fundamentally, as I said, what is this? How does it work? And we're thinking of this in a kind of a diagram of can do, can't do, of what AI can and cannot do, and then what students should and should not do, as a kind of a comparison of, okay, AI cannot do this, it cannot do X, Y, or Z, and students should not use it for that, versus it can, for example, produce text, but we don't want students to submit text that is not their own writing. So what can and can't it do? Then to talk about how to use it with integrity. So how to use it with with references and how to reference it. The general consensus on this seems to be that we reference AI in the same way as you would reference personal correspondence. So whichever referencing style we use, the consensus seems to be settling around that whatever format would be used for referencing personal correspondence is how we reference AI. But there seems to be a kind of backwards and forwards on that. But what the message we're trying to get with students for this is, if they are using it, tell us how and where they're using it, so that at least that bit is transparent. And then Scott, I'll pass over to you.
Oh, thanks. So I am the Deputy Head of Student Learning Development. Andrew is my boss. And under me is the team responsible for seeing students across the College of MVLS. So Dr. Rosalind McKenna is the main contact that students would have. Her job title is Effective Learning Advisor, which, as a former holder of that job title, I always thought was really useless because it's so vague. But she'll be out talking to students where she's been requested in course about things like academic integrity, how to write well, and how to avoid plagiarism. So if anybody here has a student that they want to put in contact with someone for a discussion about this, or is running a course, or has a group supervision responsibility and wants someone to come and talk to the students, Rosalind would be your main contact. We also have other advisors. So there's a pair of international advisors who deal specifically with the challenges of coming from another academic culture before you come to study here in Glasgow. Sometimes that's about the language, sometimes it's about just expectations of what makes good academic work. And AI is obviously a big part in that, because how we cite other sources is often the cause of confusion there. And we have a maths and a stats advisor who are also working on ways to present, for example, statistical analyses in a way that appropriately uses AI. So sometimes a lot of what people are doing now is using it as a coding buddy. So you're working on R, you've got some code, you've got an error in it, and essentially you throw your code into ChatGPT and say, what's wrong with this? And it works like a fancier version of the help guide for RStudio, which is probably fine, versus asking it to come up with some code de novo, which is probably not fine. So there's a suite of people there, and the link is at the bottom of the screen there, but the easiest thing to remember is just gla.ac.uk/SLD for student learning development, and you can navigate through the various types of advisors. We realise that there's notionally time attached to this for questions. So if anybody's curious, we can show you some of the things that we have tried to get ChatGPT to do, so that we could show to students in good faith, here's something that it is useful for. But actually, for every attempt that we made, we found that there were significant problems that would have caused the students issues if they had believed that it was good enough. And one of the things that Andrew had on a slide, which we talked about emphasising, but maybe we didn't, Andrew, could you just go back 2 slides, was that one of the main things about this is that it's a joint effort. So we can talk to students about what what AI, generative AI, can and can't do, and where students should or shouldn't use it. But the schools also have a responsibility, according to the university's policy, on deciding what level of these 3 different involvements the students can make. So no AI at all, use it in these very specifically guided ways, or use it however you like, as long as you tell us in which ways you have used it. And I think that's everything that we had to say. Thanks.
Great, thank you all so much. That was really interesting. We have a couple minutes before our next presentation, so does anyone have a question? Feel free to put them in the chat as well. Hamish.
Hi, yeah, that was really interesting. I use ChatGPT as a kind of coding buddy sometimes, and I was interested in your point about not using it for creating novel code. However, sometimes when I've used it, it's actually I've asked it a question in kind of normal text English, and then it's led me to, I think, much quicker way of accessing the actual code I would be using. So I wondered why you felt that using generative AI for creating novel code was not so good, not allowed.
Okay, so I unmuted and Andrew put his hand up. I can see him giving me the nod. So I think it's just about what you're assessing your students on the ability to do. And that principle applies across all of the uses, whether it's about code or whether it's about full prose in an essay or a dissertation. If you want the students to demonstrate that they have the ability to do a task and they circumvent that, they shortcut that by getting ChatGPT to do it, that they're walking out with a degree that says, yes, you're qualified in all of these intended learning outcomes for your course, when actually that might not be the case. We were talking in our meeting just beforehand, the one I said that we'd all just spelled out of before we came here, about how actually in practice and in industry, for sure, that might be the normal thing that everybody does. So it's just up to you to make that decision as a course coordinator, if that's your position, about whether you're happy with the students shortcutting it straight away, or whether they're still at the level where you would want them to demonstrate the sort of like by hand ability to do that, I think.
There's just on the back of that, there's the additional bit that the students that the assessments are the product of the student's own work is part of the code of conduct. So if that kind of, if you are assessing them exactly as Scott says on the code, then that should be the product of their own work. But if you set it out, so with those three approaches to AI use, with the middle one being it can be used in a particular way for a particular assessment, then you might say in a particular assessment, for example, the creation of the code can be done in ChatGPT, but then maybe the evaluation of the impact of that, or the reliability of that, is the work of the student. That I think is the line. And we both, Scott and I, say that knowing that this line is the blurriest, fuzziest line. But it's that work for assessment should be the product of the student's own work. That makes sense.
Great. Thank you both. I think we will move on to our next presentation. Sorry, everyone, but if you have more questions, feel free to put them in the chat. And it looks like Helen is already responding to those, which is great. We can have a round of applause. Whenever you're ready, if you want to be seen, you'll be over there. If not,
sure. Okay, well, I'll kind of pop over around. Okay, thanks. Hi, everybody. So my name is Nick Riches. I'm a public health registrar. I'm currently out of programme doing a PhD, which is funded by Wellbeing Trust, and I'm sponsored by the Liverpool School of Tropical Medicine. But I have two Glasgow supervisors, so Peter who's in the room, and then Mia, who I saw is Mia Crampon, who's joined online. And I've actually just moved back to Glasgow after 2 years over in the long way in Malawi, in Southern Africa, which is where I've been doing my field work for the PhD. So I just wanted to give a bit of an overview of my study, the Chiwindi Study, or part of it, and then a few of the findings and some reflections. Thank you. So in terms of the reason for doing this study, so I started off really by having a bit of a blank slate of what I could do for a PhD. So I approached Mia, who runs the Malawi Epidemiology and Intervention Research Unit, which is a unit based in Malawi, which has two demographic surveillance sites, one in Lilongwe, an urban site, the capital, and then one in the north in Karonga. And we were discussing what some of the big health issues were in the two sites. And so liver disease came up as quite a significant problem. And when we looked at the verbal autopsy records from both sites, it features repeatedly in the top 10 causes of death for men and women. We know that for Malawi and similar settings, the overwhelming leading causes of cirrhosis and death from liver cancer are viral hepatitis, predominantly hepatitis B, and hazardous alcohol consumption. So the plan really for this study, and Chiwindi means liver in Chichewa, the plan was to focus on these two leading risk factors, so Hep B and hazardous alcohol consumption, try to better describe the burden of those risk factors with respect to space and time, and then to look at the associated prevalence of liver disease with both of those, and then to describe some kind of public health interventions to try and reduce some of that burden of disease. So the study itself is nested within the long-term condition study, which is a big Wellbeing Trust funded study, which is being delivered through Miru, which is essentially re-enumerating and taking physical measurements and questionnaire data from the residents of the two demographic surveillance sites. There's about 60,000 adults split between Lilongwe and the Karonga sites. And so I was choosing to nest within that to make use of all this covariate data they're collecting, to make use of their stored blood samples, which I was using for the hepatitis C survey. And so trying to conduct my study kind of running alongside this larger LTC study. So quickly, so the LTC study is planning to sample all of the, and it's ongoing. It started 2 years ago now, planning to sample all the residents aged 15 and above in both sites. And so far in Karonga, they're managing to capture 95% plus. In Karonga, they've been working for over 40 years in that site, and there's data we can link back to going over 20, 25 years, which is a fantastic resource. In Lilongwe, the response rate is slightly lower as an urban population getting newly established, but still really high response rates for both sites. We've been consenting anyone aged 18 or over to have a hepatitis B test. And we collected samples between November 2021 and then May this year. And so in total, we collected about 4,500 samples and tested them in our lab using a manual ELISA test. And then we would repeat all of our positive samples in duplicate and share all of the results with our participants. So positive results and also negative results, which is quite a big job of work in a setting where a third of people don't have access to a mobile phone. So there's a huge amount of resource that went into sharing those results. But through that, we've really helped to raise awareness particularly around hepatitis B in the community. For the alcohol data, which I won't focus on in this talk, and the full audit score, so the alcohol use disorder identification test was asked in full of all participants in the study. So that's a really strong resource that we can link into. So for our positive cases, so for the Hep B positive cases, and also for the sample that we took a stratified random sample of people who scored 8 or more on the audit score, so score indicating hazardous alcohol consumption. We would then bring those people into our clinics. So we had two clinics that were hosted within the Miru NCD clinics at both sites. And there we would do a clinical review, we would do repeat blood testing, including we had a gene expert machine so that we could measure viral loads. We had a machine called a FibroScan, which is basically a form of ultrasound device which can measure the elasticity of your liver. So it gives you a numerical value, and at a certain cutoff it indicates liver fibrosis. Above that it indicates liver cirrhosis. It's quite a nice simple bedside test you can use to look for features of chronic liver disease. We then worked up in terms of assessing treatment eligibility for hepatitis B. Hep B should be very easily treated. So the first line treatment is a drug called tenofovir, which is the first line treatment for most of the HIV regimens in Malawi. So actually access to the drugs is not a problem. We work closely with the ministry, who are happy for us to use as many of the HIV drugs which are procured through Global Fund for our work as was necessary. The challenge is trying to work out who needs treatment. And for hepatitis B, the current paradigm, although it's being challenged, and I think for good reason, is to focus on the people who are at highest risk, who have features of liver disease, and start those people on treatment to reduce the risk of progression. The problem is the WHO guidelines are based on tools such as the FibroScan or the Gene Expert platform, which is completely inaccessible in almost all of Malawi, or really all of Malawi for the most part. And so what we were trying to do was also work with the ministry to find some more cost-effective but evidence-based ways to risk assess who needs treatment. We also set up alongside this a contact tracing system. So we managed to find another 30 positive cases just through bringing in household and sexual contacts of cases and testing them for as well. Yeah. So I'll just go through a few quick slides with some results, and then I'll just go over a few conclusions from the study. So in terms of the epidemiology of hepatitis B, one thing to point out is we ended up with a much larger sample size in Karonga than in Lilongwe. So obviously my period of field work was fixed by many reasons, and the existence of COVID unfortunately pushed a lot of deadlines back in all sorts of ways. So it meant that because the Karonga site was more established, the LTC study I mentioned started first in Karonga. And so we extended as much as possible in Lilongwe, but the total sample size in Lilongwe was 1,400 versus about 3,500 in Karonga. So you can see that the Lilongwe epidemiology is the bottom row, the uncertainty is much higher. But what you can see at both sites is that there is a peak essentially between the age of 30 and 50 years, which is quite nice and quite apparent in Karonga. And you can see on the left-hand side, it's women, on the right-hand side men. So the peak is typically higher in men than in women. The tail in the long way is very hard to make sense of, but there are some plausible reasons why there might be a slower decay in prevalence as you get older in the long way. But yeah, in terms of the epi, we got some nice curves from our models. Thank you. And in terms of risk factors, so I said we have a wealth of kind of covariate data from the LTC studies. We're starting to kind of build and develop the models a bit more, but in terms of the most obvious risk factors, so Hep B, clearly in a setting like Malawi, and the epidemiology will be very similar in neighbouring countries. It is a disease that's more common in those aged between 30 and 50, and then almost twice as common amongst those who are male and those who are HIV positive. As I said, we found higher rates in Karonga than the long way, which was surprising, but obviously we didn't sample quite as many in the long ways, so it's hard to say with confidence that there's any clear pattern going on there. So in terms of some of the things we tested for, so on this slide there's along the top ALT and AST, so these are transaminases, so markers of liver inflammation, and then along the bottom platelet count, so platelet count drops in chronic liver disease, and then liver stiffness is what was measured by our FibroScan tool, so higher values are indicative of fibrosis or cirrhosis. So we found that looking at the different parameters we measured, I haven't displayed them all, about 40% of our cohort had some features of liver disease. And what we did find was that those features were significantly higher in men than women. So the rates of disease were, depending on the parameters, sort of 20 to 40% higher amongst men. But I did mention we collected all this alcohol data. So if you correct the regression model, if you adjust for alcohol in the analysis, it almost completely takes out that sex-based difference. And if you look at the epidemiology of alcohol consumption in Malawi, you see a very similar peak. So it's men between the ages of 30 and 50 again who have the highest rates of high-risk drinking. And so a key finding here for the hepatitis program is to really focus on these comorbidities, because it may be the alcohol that's driving the disease as much as the underlying hepatitis and the underlying viral hepatitis. Next slide, please. I won't focus on this slide too much, but what I would like to do is just emphasize with this platform, the Myriad platform. I mentioned that we have all these linked samples that we can draw on. There was a study called the NCD study, which is the bar on the left-hand side, which was very similar to the LTC study, so run between 2013 and 2016. And what we can do with, particularly in the Karonga site, which is a rural site where there's much less churn in the population, you're able to track people over time. And for hepatitis B, the natural history in an African setting is very poorly understood. What we know is that people with hepatitis B frequently die of liver cirrhosis and cancer in their 30s, 40s, 50s. It's much more aggressive than the genotype that we see in Asia and Europe. And people don't quite understand whether it's just a genotype or whether it's patterns of comorbidity, perhaps alcohol, perhaps aflatoxin contamination in food. So what we're hoping to do with this platform, we've got funding now to continue longitudinal monitoring of our cohort going forwards for at least the next 5 years. We hope to better understand parameters such as the APRI score, which is the AST to platelet ratio index. And that's one of the tools which is used in lower resource settings to describe who needs treatment and who doesn't. And so what we can start doing with linked samples, and the cutoff of 0.65 is what's used in Malawi to guide treatment. We can say, well, actually, how predictive is the high APRI score over a 10-year period of whether you will continue to have features of liver disease in the future? And of course, the answer is that all of these tools, short of having the fancy diagnostics, they're very limited. However, there's increasingly an argument for saying, well, let's take a public health approach. We use tenofovir as HIV pre-exposure prophylaxis, so why not consider using a much more widely for hepatitis B treatment? And but at least with this platform, we can start to look at some of these things. And then finally, in terms of assessing treatment eligibility, so we work people up to the European gold standard criteria. So of our group of 168 that we assessed with Hep B, we found that 11 of them met our criteria. So that's 7%, 6.5%. And this is in an asymptomatic population of people who obviously we picked up through routine surveillance. So this is lower than some of the studies you bear welcome to them. So most of the other, what epidemiology there is in Africa is generally from kind of high risk hospital-based cohort. Quite useful to have this data to understand the scale of the problem. And this was me just training the ART clinicians at our local sites in the new guidelines. So they, since this training was done last year, they've been initiating and following up people long term. So it's lifelong treatment with ART once it's been started. Great. So just a couple of final slides. So the prevalence of hepatitis B we expect to be around 4% across the whole of Malawi in the adult population. So it really is a huge number of people. So all of the cases that we picked up, so the 170 cases across both sites, they were all new diagnoses. No one was previously aware of the diagnosis. And so within that, at this point, about 1 in 15 requires treatment. But we're now starting the 1-year follow-ups, and we're already finding people who've progressed even over the course of a year. So I think we're just trying to highlight the scale of the problem and the opportunity within a short time frame to scale up some relatively low cost tests to try and address the challenges. We're trying to improve the approach to case finding, which is a key barrier to improving things, by looking at these risk groups that we've mentioned, and also looking at how we better address this disparity in terms of disease outcomes between the sexes. As I said, we've got funding from a few different sources now to continue follow-up and hopefully expand the cohort in Karonga. So we've tested in Karonga 3,500, but we'll have consent from about 20,000 people. And we're just looking to see whether we can do some additional testing on these stored samples, which are sitting in the laboratory. But at the very least, for our baseline cohort, we've got funding now to continue this 1-year review where we'll repeat these clinical measurements. And then, yeah, just some final reflections. So it's been a real privilege to have the opportunity to work in Malawi. It's a beautiful country. For those of you who have the opportunity to go, I would recommend it. And the opportunity to work with Miro, I think, is one I'd strongly recommend in terms of the quality of the platform, in terms of the the people who are there on the ground. My main medical assistant, Tanya, would bump me about on one of these motorbikes, and you could essentially give him the name almost at random of anybody in the DSS, and he would immediately be able to sort of go to their house and pick up the last conversation he had with them. These are workers who've been embedded in the community for years and years and years, and it's a really special resource. Our office in Lilongwe was also on the same site as the Ministry of Health, Department of HIV and Viral Hepatitis, which meant that I could work very closely with Wongani, who's the program lead, and we were able to, while I was there, they were redrafting the national guidelines. So we were able to make some changes, such as reducing the APRI score from 2, which is the WHO recommendation, way down to 0.65. So that really increased the numbers of people coming through treatment. And we've also managed to, working with a lot of other colleagues, set up this group called HepsiNet. The paper in the bottom right has a bit more information about it. But it's essentially a collaboration of different hepatitis B cohorts in Africa. And we've published a few papers already, which is just pooling, because the data is so sparse, trying to pool the data from different sites to come up with some broader recommendations. In terms of challenges, I've mentioned the issues in terms of nesting within a study that's already ongoing, and some of the challenges in terms of sharing results. COVID was a challenge. We also had a national epidemic of outbreak of cholera for about 10 months, so we had to keep stopping and starting and working out what was appropriate in terms of field work. And then our 2 study sites, it's a great resource to be able to compare and contrast the 2 different settings, but they're also 500 kilometers apart on quite challenging roads, so getting samples backwards and forwards and everything else was a bit of a challenge. So that's the field team down in Karonga. So this is just a minute's walk from our Karonga office. There's a beach bar on the lake, which is a beautiful spot. I had a very strong team on the ground helping me. And yeah, I have another 5 months left to write up the PhD, but I'm certainly very happy and open to people who've got any questions about this or questions about working with Miro or any particular interest in the topic area. Any thoughts collaborating. So yeah, thank you very much.
So we have time for one question.
There is a question in the chat online. If Benedict would like to ask it.
Hi, yes, thank you. Although if there's any time for one question, I don't want to hog it because I will probably catch up with Nick soon. But thank you, Nick. That's a great talk. And just for context, I'm about to start a very similar project on a different topic, but within the LTC study with Mary. But Nick, I just wanted to ask about how you chose your participants. I know the LTC survey is sort of progressing sequentially through reporting groups. Did you just tag on the back of that, or were you trying to get a more representative sample?
Yeah, that's a good question. Thanks, Penny. Nice to see you. So we had to pivot a little bit during the study. So initially, based on the projections of recruitment to the LTC study, the plan was to basically take an age, sex, stratify random sample, so to try and cover enough of as much of the geographical coverage of the DSS as possible. But because the progress was a bit slower than anticipated, essentially to get up to our recruitment target, the only thing we could do was then pivot and take essentially a whole population continuous sample as this bigger study LTC was moving through the population. So just to get enough cases for the Hep B study. For alcohol, we did a bit differently because it's much more common as a risk factor. So for that, we stratified by audit score into high and low risk. And then we stratified by age and then took a random sample from each. And we oversampled those who had bloods previously from the NCD study. But I'd be very happy to talk to you in more detail about it, Ben, because it's something I spent a long time wrestling over myself. And hopefully you'll be in an easier position because there are more cases that have accrued through LTC now.
Brilliant. Thanks very much, Nick, and congratulations. It's a great study.
Great. Good. I think we'll move on. Thank you.
Thank you.
The video screen on the right, if you click the little green arrow down the bottom corner, try that.
There.
So I'm Claire, and for those of you who don't know me, I'm a research fellow based in general practice and primary care. And I'm interested in mental health and the social and environmental determinants. And this is a presentation that's very much a work in progress, so feel free to help shape it and interpret the results, because I'm literally trying to interpret them. So just a bit of background: climate change is a growing global crisis in global mental health and health crisis. There's a range of acute effects that it can cause as a result of flooding, wildfires, heat waves, droughts. It can all cause poor health. And as well as acute effects, there's long-term effects in terms of food and water insecurity, displacement, loss of livelihoods, unemployment, and a loss of sense of place and culture. And mixed with the climate crisis is also like a lot of ongoing environmental crisis in terms of deforestation and air pollution and that, all of that. So as well as affecting physical health, it's likely to affect mental health as well. And this diagram is from the World Health Organization, which it's a policy brief on climate change and mental health. And it's worth reading if you're interested in the topic, but basically explains the pathways in which climate change can impact on mental health. So direct effects including what we mentioned, and it's also likely to exacerbate inequalities in terms of people with existing diseases are likely to be more impacted, those living in poverty, ethnic minorities, low and middle income countries, yeah, the usual suspects in terms of health inequality. And today, I'm just going to focus on a little part of this. So eco-anxiety is kind of an emerging concept in terms of feeling anxious about and worrying about the environment and the climate change. And so what do we mean by eco-anxiety? It's actually a good question because it's very difficult to define at the moment. There's lots of different terms that are used, including eco-distress, eco-concern, eco-worry, ecological grief, and there's a bit of work that needs done in terms of clarifying these concepts. But yeah, we're focusing on eco-anxiety today, and I thought this was an interesting quote just to demonstrate, especially among young people, what it might mean. So I'm not going to read it out, but you can go ahead. So within the literature, there's various definitions that have been put forward in terms of defining eco-anxiety. So one of them is here. Other people have defined it as a chronic fear of environmental doom. But generally, it's sort of as an emotional response that can be seen in places that are not just like directly affected by climate change in terms of flooding and things. But it can be worried about the future in terms of what might happen. And there isn't a huge amount of research in this area at the moment, but some studies, including a study by Hickman in the Lancet Planetary Health, which focused on young people across a number of different countries, demonstrated that eco-anxiety is quite prevalent. And it seems to be that countries that are more impacted by climate change have more concern around climate change, including countries like the Philippines, India, and Brazil. In the UK, there's still quite a high level of concern. And also, in a study, they also looked at the way in which eco-anxiety might affect functioning as well. And it seems like it can have quite a negative effect on day-to-day functioning as well. Well, there's a question around whether it's actually a clinical issue or not. And in the UK, around COP, the ONS also tried to measure worry about climate change. And they also demonstrated that it seems to be more prevalent amongst younger age groups and also amongst women. And that was, yeah, amongst all age groups. And in terms of the impact on mental health, there isn't a huge amount of research in the area, and it's kind of dominated by cross-sectional surveys. But some studies have shown that eco-anxiety can be related to symptoms of depression, insomnia, and PTSD. But it also can lead to like pro-environmental behaviour. But some other studies demonstrate that it's actually, if it's like high levels of distress, it can lead to less collective action. So I'm just going to touch on some results of the study that we're doing just now, and as I mentioned, it's ongoing. So the aim was to look at eco-anxiety across Europe and identify its determinants, and today I'm just going to focus on age group, gender and education level. And ideally I'd want to kind of look at all the different pathways. I'm not sure if that's possible or not with the data that I've got, but there's a framework, although it's focused on children and adolescents, the framework for looking at climate anxiety or eco-anxiety through a social ecological perspective, so looking at various levels in which things might influence climate change anxiety. So ideally I want to kind of adapt this to adults and just look at all the different factors. So the data we used was the European Social Survey, and they've collected data on worry about the climate, I think in 2 ways, but I'm using the most recent one. It was collected kind of during COVID, which means it's not necessarily comparable to previous data. It includes around 36,000 participants and they're age 15 and over from across 22 countries, including Great Britain and the ones mentioned here. And most of the results I'm going to present today are just descriptive, but there are some multi-level regression models that are calculated. So unfortunately, the measure that I'm using is I'm worried or fear about climate change on a scale of 1 to 5. So I've defined eco-anxiety as people who are very worried or extremely worried, which obviously there are issues with that, but that's the data we have. So these graphs just show the descriptive results by age group. So this is the proportion of people who were worried, very worried or extremely worried about climate change. And we can see that I think generally younger people tend to be more concerned. It's highest amongst people in Portugal. Great Britain's quite high up. And yeah, you're happy to kind of interpret them yourself. I know when you process something. Yeah, one thing that stood out was Iceland, I think. So it's quite high up amongst young people. In Iceland seem to be more worried, but amongst older people they don't seem to be as worried. That was the main thing. I could spot them. And again, yeah, in Italy, people seem to be, younger people seem to be more concerned, whereas they don't seem to be as concerned as older. And these results show eco-anxiety by gender. So women tend to have higher level. Again, Portugal seems to be worse in terms of concern, if it's worse. In Iceland, yeah, women seem to be more concerned than men, particularly. But yeah, happy to take thoughts on what you think's going on here, if anything. In terms of education, it's interesting that climate change concern seems to be higher amongst higher educated people, which isn't that surprising because they probably know more about climate change than expect. Yeah, particularly in Great Britain, it seems climate change worry seems to be high amongst the highest educated, not so much in the most educated. And apologies for copying and pasting that. That's as far as I've got at the moment. In terms of multi-level models, if I've done this right, we find that being female is associated with higher odds of fecal anxiety. Not quite sure what's going on with it, age, but compared to the younger people, they seem to have worse fecal anxiety. And yeah, amongst those who are higher educated, that appears climate change worry seems to be worse amongst those who are highest educated. And yeah, at the moment I've just included gender, age group, and education in the model, but I don't know if there's more things that I need to put in there. So to summarise, yeah, there's high levels of worry about climate change across Europe. It's highest amongst women, which we tend to see in the literature, amongst the most educated and generally in younger age groups. But the patterns vary somewhat by country and need further investigation. And in terms of next steps, I'd like to explore the country differences a bit more, so linking in data like temperature and other geographical and social political variables. Maybe look at the regional differences, so are there differences between people who live near the coast or not, or urban-rural differences, and also looking at the risk of future depression and anxiety. So is it a concern in terms of mental health or not, or is it, can it be a good thing? And the factors associated with who it becomes a problem for and who it becomes like a good thing for. I think that's it.
Great, thank you. Okay, Peter.
Thank you. That's a very nice talk and great progress already. I just wondered, with your outcome, one way to make a bit better use of that data, because you've basically got an ordinal score. And so rather than just modelling the dichotomous yes or no, you could actually model that whole scale, and perhaps get more insights into where the more severe is coming from the less severe worries. Yeah, we've done some of that kind of outcome response theory modelling. Yeah, very happy to talk to you.
Would that be like ordinal
regression?
Yeah. Thanks.
I guess it depends why you want to measure this, but depending on the answer to that, have you considered looking at other measures of anxiety not related to climate to see the extent to which these patterns are general?
Yeah, I hadn't thought of that partly because limitations in data, but
I don't know if the survey has something like, are you anxious about your pension?
Yeah,
worried about jobs? Do you?
There might be like financial insecurity. Yeah, that'd be interesting. Okay.
Are the data just at a national level, or have you got sub-national sort of granularity as well?
So we have, I don't know if you're familiar with NUTS regions. No. They're like a regional measure. I don't know what the equivalent is in the UK.
I think it's counties in England, and then Scotland's a whole lump on its own.
Because you've probably thought of lots of sort of climate and fire incidents of fire and flooding, and data spatial data are available at different levels, but within Europe, because you can kind of see some of those patterns. Sort of with Portugal, like that's an obvious one, but maybe rather than looking at what the differences in the countries per se, it's like what are the commonalities in terms of the climate and environment within across those countries. That's where you might tease out more definitive. But it's really cool. I didn't know these data existed.
I think there were some hands in the Zoom room. Would anyone like to unmute and ask a question?
Can I ask? Thanks. Thanks, Claire. I was wondering if you knew anything about the type of work people were doing, because you can imagine people in agriculture seeing their livelihoods threatened, being more concerned than others. And that might go some way to explaining the age relationship, where perhaps older people have seen some of these disasters happening previously and thought it's okay, after a couple of years things bounce back, or something. I don't know.
Yeah, there is, there's one thing I've thought about including, so there is quite detailed occupation data. So yeah, it's probably one thing we're going to look at.
Looks like Nye has asked in the chat what you think the possible implications of this work are.
I think it's difficult to know at the moment, but it'd be good to look at the relationship between eco-anxiety and like mental health outcomes more generally, to see if it is actually damaging to mental health or not, because if it's not, then it might not be that important in terms of mental health. It is slightly worrying that, especially amongst young people, that there does seem to be a high level of worry about the climate, especially looking at qualitative data. Yeah, it's quite interesting to see like what young people think about it.
Thanks, Claire. Really interesting. You mentioned something about political potential variables, and I was wondering what information you could draw on in terms of the governments of the different countries at the time the data was taken, in terms of the prominence or the type of climate policies they had, or
Yeah, I'm still thinking about it, but I don't know if there's like a measure. Get a whole little work during climate change.
the proportion of voting green.
I wondered also if people might have concerns about migration, like whether there are countries where people might be forced to migrate and others who might be just more migrants.
Yeah, we're still looking.
Any other questions?
Is that survey run have media data on why they get that information?
I think it's in other surveys, survey waves. It might be in that way, but yeah, another thing to look at.
Okay, thank you, Claire. Thanks everyone for coming. Thanks everyone online.